Good afternoon, everyone. Once again, you are watching Pairfect from the Daily Tribune studios here in Makati. I am Dinah Ventura. Today, our guest is a special kind of person, a woman for other women, a doctor specializing in obstetrics and gynecology. So let's get to know Dr. Jaycy Violago-Olivarez. Hello, doctor.
Hi, good afternoon, Miss Gina. Thank
Nice.
you for having me this afternoon.
Oh, we're very happy to have you with us because I think a lot of our viewers would be interested to know. Well, last month, March was Women's Month. So
Correct, that's
I
right.
think what we're going to talk about is very apt for that. And I think, not just for March, but all the time. Women's health.
Correct, that's
Okay.
right.
Yeah. So, okay, let's start off with what made you pursue the path of medicine in the first place? Is anyone in your family in the same field?
Yeah, so actually, in my immediate family, I'm the first doctor in my immediate family.
Okay.
But in my going further to my grandfather, in my side of the family, my grandfather was both a doctor, an
Mhm.
entrepreneur, and he was also in public service.
I
So
see.
he was the congressman in Nueva Ecija
Mm.
for a long time, and also the founder of JFB Rice Mill in Nueva
Mm.
Ecija, the business there.
Okay.
And really, it was his integrity in what he was doing,
Mm-hmm.
and also how he was towards people. He was able to serve people in different aspects, in healthcare, as a doctor, in business, being able to provide um, work opportunities for
Mm-hmm.
the community there.
Mm-hmm.
And lastly, as a public servant, as he tried to be able to lift the level of livelihood in that community. And it was really inspiring for me.
Mm-hmm.
And for me, I feel like he was such an inspiration,
Mm-hmm.
um, and really helped me, move forward to pursuing my visions and my dreams as well.
Yes. I hear that you, aside from being an OBGYN, you also have two businesses, right? So,
Right. Well,
so
of course, that would be number one, my true passion and what I've been working forward
mm-hmm.
for like 15 years already would be Eluvo, which is the women's digital and physical healthcare provider in
Mm-hmm.
one ecosystem. And the other one, of course, to be able to fund and to be able to, seed Eluvo
Mm-hmm.
is also the business that I'm starting with my husband or with my own family, which is PGO Enterprise. We're handling some food and beverage businesses,
Mm-hmm.
mostly in the Laguna area. So
Okay.
those are the two things.
So very busy, and you're going to be the mom of twins, right?
Yes, that's right. I think that's also one of the most important factors, of being a woman.
Mm-hmm.
Right now, we're also a lot of women are more, motivated, career oriented, but at the same time, we also still have roles to fulfill in our household, in our families,
Mm-hmm.
when we try to build our own families, no?
Right.
So this is my first pregnancy with twin baby girls.
Woohoo! Congratulations in advance. So,
Thank you.
but
Thank you.
Doc, how did you come to specialize in women? What were some of the experiences that led you to decide that you would help women?
I think first and foremost, I would say that, as I was, even before going into med school, I already had a predisposition into, wanting to take care of
Mm-hmm.
women or wanting more curious in that aspect.
Mm-hmm.
And then when I got into med school, I realized that, all subjects are difficult. All specialties are all difficult.
Uh,
They all have their own challenges and difficulties. But with OBGYN, it felt the most natural
mm,
because, for one, I'm a woman myself. And two, I felt that, you know, the calling was really there in the sense that um, I felt like it was such a bigger um, field to tackle because usually in OBGYN, you're not just taking care of one patient,
Mm-hmm.
you're taking care of two already. And for me, being being a high achiever also, I was like, oh, mas okay than yun, di ba?
Two in
So
one again.
with one, yeah. But really, Jenny, I think it was really more of um, it came naturally
Mm-hmm. Mm-hmm.
and instinctively. Of course, you follow something that you do. If all the paths are going to be difficult,
Mm-hmm.
find the path of least resistance, and of course the path that you feel you would excel well in
Right.
or do well in.
Of course, of course. But what do you think is wrong with women's healthcare in the Philippines? Is there anything lacking or main areas of concern that you felt the need to address?
Right. I was given the chance to rotate both in public institutions and in private institutions.
Mm-hmm.
And you could really compare the healthcare system in these two different sectors.
Mm-hmm.
And at the same time, you could see the gaps. Um, I think first and foremost, you see how even in the private sector,
Mm-hmm.
there's a lack of information or
Mm-hmm.
access to information about women's health care.
Okay.
Actually, even going back to, I came from an all girls school.
Mm-hmm.
And I remember we never really talked about women's health care there, right? So, even if it's an all girls school,
Mm.
so where do you actually get this information? You get it
Right.
from your mom, your titas, your friends,
Mm-hmm.
but generally there is so much more, there's a lack of information and connection to where women could go
Mm-hmm.
to find reliable information about how they could take care of their health, particularly reproductive health, right?
Yes.
And then second to that would be the problem also in the defragmented system.
Mm-hmm.
Sometimes you're going to say that this is what the patient needs to be done so we
Mm-hmm.
can move forward with the management.
Mm-hmm.
But where can you find that service to have it done? And
Mm-hmm.
most often it's either, like you have to ask friends or referrals just
Mm-hmm.
to know where to go to have something done.
Well,
And last but not the least, I feel like it's also societal wise or in terms of our community,
mm-hmm.
there's also a lack of support
Mm-hmm.
in terms of, where can women go to discuss their healthcare concerns
Mm.
and find support
Yeah.
about what they're going through. Because
Right.
still, there's a lot of societal and cultural barriers
Mm-hmm.
or maybe obstacles that make it feel like women should just keep to themselves when it comes to certain reproductive health issues.
Yeah, so it's really still so hard for women to open up about it, even with family.
Right,
Okay, so you
right.
with Eluvo, you've uh, created something like a safe space for them, I suppose.
Yes. So I think with Eluvo,
Mm-hmm.
what we've created is a simplified and
Mm-hmm.
holistic approach
Okay.
to women's health. And we've also been able to, use innovation
Mm-hmm.
to one, increase the access of women to healthcare or to women's health. So, for example,
Mm-hmm.
it's an easy three-step process of talk, test, and treat. So, talk. The first step is talk, wherein women would be able to connect to their doctors or
Mm-hmm.
to a legal specialist, and they
Mm-hmm.
could do this via online
Okay.
teleconsultation.
Oh, that's very convenient.
Yes, very convenient. I was actually born of, I finished my
Mm-hmm.
residency during the time of the pandemic.
Mm-hmm.
So during that time,
Mm-hmm.
I was one of the, I guess, experimental or the pilot doctors who really learned how to navigate and
Oh.
use teleconsult
Mm-hmm.
platforms. And I saw how I had patients who were in Japan,
Mhm.
in Cebu, in
Mhm.
Davao, and I was so happy that you could reach these women wherever they were, whenever they needed.
Mhm.
And also at the same time, because it's through teleconsult, um, they can do it, you know, in in the bathroom if they want,
Wherever.
wherever they want, if they don't want people to hear them, right?
Right.
And
Mm-mm.
then, so that's the teleconsult aspect or the talk aspect.
Mm-mm.
And then we have the test, talk, test, treat. So test, the next step is usually after we have a working impression or a diagnosis, we ask the patients to do certain laboratories or
Mhm.
diagnostic procedures. And again, this is part of the usual defragmented process that happens. In my clinic, sometimes you will tell a patient, oh, do this laboratory procedure or this test procedure, and then it will take them a week before I see them again.
Mhm.
So with Eluvo, the goal is to be able to provide, right now, as we're waiting for the physical clinic to set up, we
Mhm.
do offer home services or diagnostic services, particularly for blood or sample collection and ultrasound procedures.
Okay.
So, and then last but not the least, after the diagnostic tests are done, we provide the treatment as well.
Mhm.
So, of course, to close or to holistically manage the patient, after we confirm the diagnosis, we either do a procedure or distribute medications. So that's
Mhm.
something that Eluvo offers as well.
Mhm.
So it's simplified in the three-step process:
Mhm.
talk, test, and
And
treat.
treat. Three T's of wellness. Okay. Eluvo Health. What's in a name? I mean,
All
why is
right.
it called Eluvo?
Okay. So I'm so excited to share this. So eluvo comes from the term oviole, which is spelled backwards. And
All
oviole,
right.
yes, and oviole is the reproductive organ of a flower.
Okay.
And once this ovule is fertilized, it turns
Mhm.
into a seed that
Mhm.
eventually will, if properly nourished, will grow into a flower or a fruit. So
Okay.
it's really, like a seed, an origin story. So it's how, like, we would want our patients to be planted or to be fertilized well,
Mhm.
and then help them really be their best selves as we nurture them through their healthcare journey in Eluvo.
Okay. What inspired you to establish a Luvo as like this kind of business? I mean, are there a lot of other businesses like yours, or
And
would you say this is a pioneering effort? I guess.
like really looking, even again, this vision has been there
Mhm.
even before I went into med school. Like, thinking of it, like, why can't we simplify it? Why can't we create separate centers or non-hospital based institutions, particularly just for women's health?
Mhm.
And surprisingly, that was 15 years ago, and still, there aren't like much that are coming up.
Mhm.
Now, looking into, of course, the next step, I wanted to bring in innovation and
Mhm.
raise the level of healthcare services. So I researched also. I did my research,
Mhm.
just even around our neighboring Southeast Asian countries. And when you look at our Southeast Asian countries, it's so surprising. For example, in Singapore,
Mhm.
their population is just about 3 million or so. But, and here in Metro Manila, just Metro Manila, our
12?
population is 12 million. And
Wow.
if you research women's health or women's clinic
Mhm.
that's not hospital based in
Mhm.
Singapore, there's so many. And the services that they offer are just so um it looks so advanced, so pleasing or so inviting to do. Like, it
Mhm.
makes me want to go there because they're already, 5 to 10 years
Mm.
advanced in the services that they offer.
Mm-hmm.
And I think that's also what inspires me, like we deserve those kinds of services here in the Philippines. And I think it's about time that we start pioneering, we start pushing forward to establishing these types of institutions
Mm.
here. Because we're already, 5 to 10 years behind.
Oh no. All right. So it's a good thing we have Eluvo now and to start
Yes.
the start it to start the trend or that path. So anyway,
Right.
Dr. JC, thank you very much for that. We'll find out more about the business and about you, of course, after a short commercial break.
And this break is brought to you by Angkas, Beat the Traffic, Bayad Center, hashtag Bigger Better Younger Bayad, and you can buy it all. Globe, atin ang mundo. Meralco, ang liwanag ng bukas. SM, we've got it all for you. Smart, live more today. Union Bank, it starts with you. Infuse yourself with the knowledge needed to hone your business skills. Business Sense, a show where we engage with entrepreneurs, startups, and MSMEs in meaningful discussions on business growth and current marketing trends. Airs every Monday, 10 a.m., only on Daily Tribune's Facebook page and Tribune Now on YouTube. Tune in to Daily Tribune's show aimed at addressing the needs and problems of our OFWs from different corners of the globe. Hear about their plights and success stories every Tuesday and Thursday, 3 p.m., only on Daily Tribune's Facebook page and Tribune Now on YouTube. Straight Talk dives deep into present issues of leadership, politics, business, and more. Engage in insightful conversations with industry shakers, government leaders, and trailblazers every Wednesday at 10 a.m. only here on Daily Tribune's Facebook page and Tribune Now in YouTube.
And we're back on Perfect. We're still here with Dr. JC Olivarez. So, Doc, ayan, we were talking about the how the Philippines compares with other countries in terms of women's
Right.
healthcare. So, can you take us back again to like what is the real situation in the Philippines right now? You said you're 5 years behind in terms of what, and in what ways can we still catch up?
I think, you not just in healthcare, but in a
Mm-hmm.
lot of aspects, both economically, structure wise, it will really take one step at a time.
Mm-hmm.
It's not going, I don't think that we'll be able to achieve the same level right away, in 5 or 10 years, but we're moving there forward.
Mm-hmm.
And again, it takes more than just one person, two people. I really believe we will need an ecosystem
Mm.
to, take us to the next level.
Okay.
So, in terms of the private sector,
Mm-hmm.
I consider myself as somebody in the private sector being able to share these ideas
Mm-hmm.
and help these visions come to life. But at the same time, I feel there is also that need to partner with our public sector.
Mm-hmm.
If you look at the RH bill that has been passed in 2012, that was more than 10 years ago. But in terms of there has been progress. Yes, I've seen it. More information and
Uh,
education wise on, a lot of reproductive health care concerns.
mm-hmm.
But there's still a lot of cultural, I think it's a lot of cultural barriers.
Mm.
And again, I think it takes more than just one person, having this opportunity to share this with you, Miss Dina,
Mm.
and the reach of Daily Tribune will really help engage other people to make
Mm.
this more of a normal topic to discuss
Yeah.
reproductive health. We need to talk about it.
Oo
We
nga
need
eh.
to,
Why is
yeah,
it so hard? I mean, like, it's just, di ba?
I think
Why?
even, even with friends,
Mm-hmm.
it's easier when I noticed that it's easier when it's smaller groups because
Ah.
of, the confidentiality, the
Mm-hmm.
trust that you build with them.
Mm-hmm.
It's more difficult when uh they're bigger workshops. or you try to create a bigger avenue to discuss these amongst people who aren't in the field of
Mm,
medicine.
right.
But I'm also happy to see that we're
Mm,
slowly moving there. I guess there's a lot of taboo um
still.
still, yes, and also a lot of misconception.
Mm,
In healthcare, in women's health, we women experience different um, issues in our different life stages.
mhm,
So I think one of the hot topics now, actually, that I've been noticing is the discussion on menopause. And
mhm,
it's true because, menopause, the symptoms of menopause could be prevented if only it was treated earlier, or if only women talked about it during their perimenopause period. And then, going back, even in
mhm,
pregnancy, infertility,
mhm,
there's so much innovation already in terms of reproductive endocrinology or IVF. So, if women just knew when they could freeze their eggs or have options about
mhm.
these things earlier, they would be less pressured in
Mhm.
their timeline in certain things in their career or their life. And
That's
then,
very true. That's very true, no?
yeah, there's a lot. And
Mm,
then even for the younger ones,
mm,
if only there was access to proper information on prevention, screening,
okay.
um, proper sexual practices,
Mm.
that already prevents a lot of the burden of disease that are recorded in the country. I
Wow.
just also want to add, cervical cancer in the Philippines is still the number two
Mm.
killer in women here in the
What's
Philippines.
the number one?
Breast
Breast
CA.
cancer and then cervical. Okay.
Yes. Pero the thing kasi with cervical cancer,
Mm.
um, it's so easily preventable. That's the thing. It's preventable. If only women knew proper prevention and
Mhm.
screening. So even those things, parang sayang, di ba?
Mm.
But because I guess there are certain barriers, like again, it's taboo to talk about sexual
Mhm.
practices.
Mhm.
It's taboo to discuss it even with your, like, you're not gonna talk about those practices with your parents, diba? So you talk about it with friends who also are just as clueless if you are starting,
Yeah.
your ages of sexual awakening.
That's
So I
true.
think you just need, braver people to talk about this
Uh,
and make it more normal.
normal, yes. There's nothing wrong with discussing it.
Exactly.
It's
Yes.
about health anyway, right?
Correct. Agree.
Oh, yeah.
I think it's there. We have to
Uh,
start there.
so, what about you? You're pregnant right now. So, tell us about your health journey as a mom to be. What
Right.
were the things that you had that you didn't know, even as a doctor, like that you would experience? So, like,
Ah,
anything you would like to share about that?
actually, as a mom to be, I think I'm very lucky. And then a mom to be and an OBGYN, I would have to say I have an advantage in that aspect because I'm knowledgeable of what happens, what
Mm-hmm.
to expect.
Mm-hmm.
Um, and I think that's also a good thing to point out in terms
Mm-hmm.
of, like, again, if you're more knowledgeable about something, you feel more in control of,
Mm-hmm.
your healthcare journey. I think it's a perfect example. But I also do have to say,
Mm-hmm.
because this is the first time that I'm pregnant,
Mm-hmm.
and it's also pregnant with twins, I couldn't help but, there's really some at times when I'm anxious or
Mm-hmm.
even, paranoid
Mm-hmm.
because I'm thinking all of these medical complications that might happen to me.
Mm-hmm.
But the thing is, I'm also very lucky that I have a very supportive community that's helping me. First off, my husband is
Mm-hmm.
very, very supportive,
Mm-hmm.
very caring, very loving. He, it's all yes, ma'am. And then, he also tries, even if he has a very busy schedule,
Mm-hmm.
he always tries to come with me to my prenatal visits.
Oh,
So I think
that's
that's
very
a
nice.
factor. Yeah, it's a very very important factor. And then also, of course, my family and friends are very supportive. I think those that's also a perfect example of saying why an ecosystem is so necessary
Mm-hmm.
or important when women are trying or going through their, healthcare concerns and their healthcare journey.
And apparently, it doesn't stop no from your youth to your adult years and then senior years. There's always something different, a set of different problems or
Correct.
challenges for women to face.
Right.
Mm. So,
It would be nice to find an avenue where women
mm,
could, or even just, find people who are going through the same thing. Because, again, we shouldn't be doing this alone. I
right.
think a lot of women are going through the same thing. We just need to connect them
Mm. Through Eluvo, right?
through Eluvo. Yes.
So, well, you've been talking about it throughout our conversation, but for you, if you were to encapsulate your thoughts on this, what would be the ideal situation when we talk about women's health care here in a country like ours, where the culture is really quite conservative? So,
I really believe that the ideal situation of having an optimal women's health um, ecosystem
mhm,
would involve three factors.
mm,
And that would be number one, access to reliable information. So again, it's so important that women themselves are knowledgeable of what they need to take care of themselves. That's one. Next would be the next important variable is having the services that would address the women's needs. So, knowledge and then the services. And last but not the least is a supportive ecosystem or a
mhm,
supportive community,
mhm,
society.
right.
Will not be sustainable if we provide one and two but three is not going to push or support what we're trying to achieve.
Okay.
From the inner knowledge of one person to something that could be provided by Eluvo to something that should be provided by the entire community
Mm,
or, in this sense, the Philippines, our
yeah.
public sector.
Parang I don't know, it takes a village to
Yes,
to
correct.
to care
It
for.
really takes.
Right, right. So, what has been the feedback or reaction to Eluvo, your idea of this kind of business so far?
Surprisingly, before my launch, um, again, and I guess going back to barriers and obstacles, a
Mm-hmm.
lot of there would be older people who
Mm-hmm.
wouldn't really understand like the need for it. Like, why not just a multidisciplinary diagnostic center, di ba?
Mm-hmm.
There's a lot of diagnostic centers naman. But again, for me, coming from the field of healthcare as a woman myself,
Mm-hmm.
and like really doing a study on what particular needs do we have that aren't addressed yet here, it needs to be more specific.
Mm-hmm.
Diba? We have specific needs, and it would be great if we have a solution
Mm-hmm.
or a healthcare provider that understands or focuses particularly on women's health.
Mm-hmm.
And once I was able to get this across and be able to relay what Eluvo can offer, I'm so glad to say that women are more open to it. Um, Women are realizing the advantages of having a healthcare provider such as Eluvo, and at the same time, it's really empowering as well
Mm-hmm.
because then they have the option to, you know, take control of their healthcare
Mm-hmm.
based on the information that Eluvo has been sharing to them.
Right.
So I'm very happy to hear that and to see that that's where we're moving forward to.
Yeah, that's no, that's good to hear. But it'll take some time, right? And you just
It will
need to
take
keep on
time.
going. So at this
Just
point, what's your advice to women who are seeking to have the best life or be the best version of themselves?
for me, I would say that I think the key to having the best life and best self is self awareness
Mm-hmm.
and being able to know your strengths and limitations. And from there, learn how to love yourself. It's really that. Like, sometimes it's really knowing what's best for you
Mm-hmm.
and knowing what's best to do for yourself will make you the happiest.
You know,
Of course,
di ba
that's
parang
not
it's so hard for Filipinas to do that, no? Generally, yung like to say that
very,
I would like to love myself, parang, di
yeah,
ba? That's cultural, I think, also, eh.
very
Mm,
cultural. But
mm,
I think at the end of it, naman,
mm,
if you love yourself,
mm,
you know your limitations, and part of loving, because if you love doing what you do, or
mm,
you love, caring for others as well, that's part of who you are. That's
mm,
part of um, loving yourself.
mm.
But let's not forget, me time and also, time management, knowing our limitations. I think that's the best thing. Like even for me, I
Mm.
know my limitations,
Oo nga.
especially now that I'm 31 weeks pregnant.
Yeah.
Yeah.
Oo. So there are so many aspects talaga of that self-care or loving yourself that you need to consider. It's not just physical, mental, spiritual, di ba? But Doc, we'll talk about that more before we end the show after a break.
And this break is brought to you by Angkas, Beat the Traffic, Bayad Center, hashtag Bigger Better Younger Bayad, and you can buy it all. Globe, atin ang mundo. Meralco, ang liwanag ng bukas. SM, we've got it all for you. Smart, live more today. Union Bank, it starts with you. Infuse yourself with the knowledge needed to hone your business skills. Business Sense, a show where we engage with entrepreneurs, startups, and MSMEs in meaningful discussions on business growth and current marketing trends. Airs every Monday, 10 a.m., only on Daily Tribune's Facebook page and Tribune Now on YouTube. Tune in to Daily Tribune's show aimed at addressing the needs and problems of our OFWs from different corners of the globe. Hear about their plights and success stories every Tuesday and Thursday, 3 p.m., only on Daily Tribune's Facebook page and Tribune Now on YouTube. Straight Talk dives deep into pressing issues of leadership, politics, business, and more. Engage in insightful conversations with industry shakers, government leaders, and trailblazers every Wednesday at 10 a.m. only here on Daily Tribune's Facebook page and Tribune Now in YouTube.
And we're back on Perfect, still with Doc JC of Eluvo Health. So Doc, what's a normal day like for you? You being such a busy woman.
Right. So I think the normal day would be maybe I'll just start off with like when I wake up,
Mhm.
I really take time to pause.
Mhm.
As much as possible, I don't want to look at my phone at first. It's such a, it's difficult, but it really helps. The first thing that I try to do is like I meditate
Mhm.
or I try to, zero in on self awareness. I use Headspace for this. So
First
just
thing, first thing in the morning.
yeah, in just 5 minutes,
Okay.
5 minutes of your time,
Mhm.
meditate, be grateful, what you want to do or what you want to achieve. And then afterwards, I go through the list of things that I need to do throughout the day. I
Mhm.
break it down between um, my two businesses,
Mhm.
Eluvo and also my other business. And then afterwards, I prioritize which are urgent,
Mhm.
like which ones are the most urgent ones, like that. Um, and of course, in terms of
Mhm.
like taking care of your health, I always make sure to eat well.
Mm.
I think it's so important. Before I used to exercise a lot, but now I used to wake up at 5:30 a.m. to
Just
play tennis.
wow.
Yeah, just so that, yeah, but that was before I got pregnant, Right now, I just, up until I could, I was walking. I
Okay.
would walk around the area. But now I have to take a little bit of rest from that first.
Oo.
Exercise is so important.
Mhm.
It also helps you clear your mind
Mhm.
and gets the right hormones to get you through the day. And then before also when I was, in med school or in residency, I would intermittent fast.
Mm.
But now I feel like because I'm getting busier,
Mm.
to be nourished also physically. So
Right.
I try to space out my diet throughout the day.
Mm.
Also important tip for women,
Yeah.
it's more important to do small, frequent meals
Yeah.
rather than starve ourselves, because it can increase cortisol levels
Mm.
compared to men.
Mhm.
uh, Maybe it works. And again, some of these studies in diet and nutrition, if you look at the journals, they're actually done on men more than women.
Ah.
Even
Oh.
that, even there. So, there's really like a lot to, there's a lot of advances that we need to move forward or
Mhm.
progress on. So
Mhm.
anyway, going back, so there, I
Mhm.
nurse myself, and then of course,
Mhm.
um, I always have to make time
Mhm.
for my family.
Yeah.
So that would be my husband. At
Mhm.
the moment, we
Mhm.
always make sure we eat dinner together, we talk,
Mhm.
try to have, your phone away. I know, like, we're both very busy, but that's also very, very important.
Mhm.
And yeah, just trying to get the right amount of sleep also
Which
is
is
so
very hard, I suppose.
very hard. Very hard, but we
Yeah.
try our best, right? Um, as long as we're putting the effort there.
So it's very talagang ganun ang I think that's how women should care for themselves. Like as you said, start the day just being quiet in yourself and then end it with family as well. So that's very nice and very good advice. So, Doc, I would like to ask you so many other questions about specific health issues that we could
Right.
probably share with women. But for now, thank you very much for joining us. And it's been nice getting to know you and the business that you put up, which is, I think, something that we all need. So, before we end the show, would you like to give us your parting words
Okay.
to our
So
viewers?
first off, I'd like to thank Daily Tribune for giving me this opportunity to share a little bit about Eluvo. I want to thank Miss Dina for hosting and um, really taking the time to get to know me and get to know Eluvo more and being part of this journey to try to get women more involved in
Mm.
their healthcare. So Eluvo Health, just for more information for women, is a one-stop shop. It's a digital and physical healthcare provider for women in one ecosystem. And we've simplified the approach to a three-step process of talk, test, and treat. You could reach us via www.eluvohealth.com, and you could also follow us in our social media platforms where we would want to share reliable information about women's health, um, for all women in their different life stages. So you can follow us at Eluvo Health in Instagram, and Facebook and TikTok. So thank you so much again, Daily Tribune and Miss Dina and team, for the opportunity for me to share Eluvo to everyone.
Wow, thank you so much. I mean, it was a pleasure getting to know you and your business. So, I hope to meet you in person soon, and I
Yes, I
wish
look forward
you,
to that.
I wish you good health and good luck with your businesses. And so, everyone, thank you for watching Perfect. See you next week. This has been Dina Ventura.